Hi, I'm Amanda Janesick, and I'm a postdoc in the laboratory of Dr. Stefan Heller. The price that some people pay for surviving a life-threatening bacterial infection is the loss of their ability to hear. This primarily affects infants in neonatal intensive care units who survive life-threatening infections while having to suffer the consequences of hearing loss. This is a potential loss to society because infants have not yet begun to learn to listen and speak when their hearing is suddenly stolen from them. Antibiotics that damage the inner ear are called aminoglycosides, and one that you might be familiar with is gentamicin, which also happens to be the most effective, least resistant, and cheapest antibiotic available. For this reason, lower socioeconomic regions and developing countries have a worse problem, in that gentamicin is 100 times cheaper than less toxic alternatives, and its use is more widespread and not well monitored. Gentamicin is used without assessing the dose in the blood, and when levels get too high or too persistent, the residual wreaks havoc on the ear. Researchers in the Stanford Otolaryngology department study the ear, and we are attacking this problem from multiple sides. One solution is to improve the antibiotic drug. Another solution is to make the inner ear less susceptible to damage, or even better, coax the inner ear into regenerating hearing after damage. This last idea might seem the most far-fetched, but it is actually quite tenable because all non-mammalian vertebrates, frogs, lizards, salamanders, birds, all have the ability to regenerate hearing after damage. So these animals have this amazing capability, and I try and understand how they do it. I study the chicken ear because its hearing organ, or cochlea, has an anatomy quite similar to humans. They have sensory hair cells just like us that convert the mechanical energy of sound into electrical energy that is transmitted to the brain. When I infuse gentamicin into the chicken ear, the hair cells die, just like they do in us. However, there's a key difference. After 5 days, the hair cells come back, and hearing is fully restored a couple of months later. Regeneration in the chicken cochlea relies on reawakening stem cells called supporting cells. Chicken supporting cells can proliferate or divide and can also morph into a hair cell, meaning that they can change their identity. They are plastic. Mammals have these supporting cells too, but they are much less plastic and lack the ability to make copies of themselves or change their fate. In the laboratory, I use a technology called single-cell RNA sequencing. This technology gives us information on all genes in each individual cell of the chicken or the mammalian cochlea. I have identified many novel genes, specifically in the chicken ear. I then compare those genes to their mammalian counterparts. One goal is to identify the type of supporting cell in chicken that is most similar to the mammalian supporting cell. And another goal is to identify the genes that the chicken is using in the regenerative process. These are the genes to target with a drug or chemical in us for intervention in the future. If we must accept that the toxicity of life-saving antibiotics is a necessary evil, we must find creative ways to replenish hair cells after they are damaged. And while cochlear implant technology and hearing devices are incredibly advanced nowadays, they are still only a Band-Aid for the real problem of losing hair cells to begin with. And until we can replenish the hair cells, please protect the precious ones that you have. Put an app on your phone to measure decibel levels at concerts, sports events, home improvement equipment, and earbuds. Take antibiotics only as prescribed. And one day, we hope that human supporting cells can be reawakened to make new hair cells.